There we go. Okay. So my talk's going to be about should no longer be done, obviously. So let's look at the history of all this. We've had a little bit of the history earlier on, as outlined by Dr. DiMaria, but the first gastroplasty was done around the 1980s. First laparoscopic adjustable gastric band was done in 1994, maybe 93. Lap band was FDA approved in 2001 and really became at its peak around 2008 or so. The VBG was not performed after the mid-1990s. The band obviously has always been done better in Australia, and I still can't understand that. In 1990, in the early 2000s, we looked at bariatric surgery really as this restrictive and malabsorptive kind of paradigm, although we're starting to change that. Early on, banding and bypass operations were lumped together as restrictive, even though the literature started to show that there was really a significant difference, and studies began to show hormonal changes with those incretin effects being important for different operations on the long term. So if we look at some of the literature, and I'll just pick out a few, and I'll have a whole slew in the back as a reference, but this is certainly not the entirety of it, but Jacques Hippens compared band to sleeve and showed that the sleeve was better. Dr. Aguasani showed the band to the bypass and found that the bypass was better. Other investigators looked at the ghrelin and showed that the ghrelin levels were lower after a sleeve and a bypass than after a band. Dr. Nguyen, in one of the few really comparative studies, showed that the weight loss failure with the band was over 16%, whereas by the bypass it was 0. And that's, their criteria, of course. Review studies showed the weight loss was 76% with a bypass versus 48% with a band. Diabetes resolution, however, was almost 80% with the bypass, and that was significantly better with the bypass versus the band. Dr. Suter looked at this and showed that 81% follow-up after 8 years with the adjustable gastric banding, and 33% of the patients developed late complications. Major reoperations in almost 22%.